Skin cancer is so common nowadays. I tell all my patients that unfortunately or fortunately, I'd say unfortunately, it is a growing business. Nowadays, basal cell skin cancer, which is by far the most common, not just skin cancer, it's the most common cancer, period. There are over 2 million cases every year in the US alone. And so skin cancer is on the rise. And whether that's because we're doing a better job at detecting it, or if it's a true increased incidence, and it's probably a combination of both. I tell my patients the most important thing that you can do to prevent skin cancer is to cover up from the sun. Like many other cancers, we know what causes skin cancer. We know that the damage occurs from ultraviolet radiation from the sun. And so the best thing that you can do is protect yourself and cover up. And there's nothing we can do when we were children and whether or not our parents put sunscreen on us, that's besides the point. From here on out, I tell patients that really the power's in your hands. And so staying out of the sun during peak sun hours between 10 and 2, or if you are going to be outside and you're living your life outside, just be smart and cover up, seek shade, and wear a hat, wear long sleeves. An ounce of prevention is certainly worth a pound of cure. I talk to my patients about the ABCDs of skin cancer. And so when we talk about, I always get the question, well, doc, how am I going to know? What does the skin cancer look like? And I have all these brown spots, and how do you pick out the one that's skin cancer? And so we typically talk about ABCD. So A is for asymmetry. Any spot that you can't kind of run an imaginary line down and have it be symmetric on both sides. Any kind of asymmetry should be cause for concern and should certainly warrant a dermatologist's keen eye. B is for borders. Any moles or spots that you have should have really smooth, nice, even borders. They shouldn't be fuzzy or irregular. Any mole or any spot with very irregular borders, again, is a cause for concern. The C stands for color variation. So most moles should have a nice, even pattern where they're a nice, soft shade. Whether it's light or dark, they're an even shade. If there are any color variations, you're seeing pinks and browns, that certainly should be a cause for concern. And D is diameter. Most spots aren't going to cause any trouble. Most moles won't cause trouble when they're under about 5 or 6 millimeters. Once the diameter of a mole gets above that, and I always get the question, well, what's 5 millimeters? It's about the size of a pencil eraser. So anything smaller than a pencil eraser typically is okay. Once you have a mole that grows beyond that, then you should think about seeing a dermatologist.